think we're okay.
Oh, it says now recording. All right, just keep going. We're okay. Great.
Okay. All right, good.
So ask me anything staining. So I'm excited, Dr. Kastner, to ask you questions about the medical side of things, because certainly I think in history, staining wasn't as much an issue as, I mean, it was because historically, because they had lice and because they had they were going to the butcher shop where they were really shechting the chickens. But given the advent of birth control pills and IUDs and all these things, it's just a very relevant question. I would say a large percent of the questions you also get are about stainings from IUD or mid-cycle bleeding, in addition to perimenopause, stuff like that. So I'm excited to ask you questions about what that means. So I wanted to, before I actually launch into the halachic side, I also wanted to note with staining, a lot of women feel guilt, that they feel guilty of, I'm staining, should I be a nida, and I don't, maybe I should just be a nida because that's better. So I'm almost positive this is Rav Henkin, but I don't know whose name exactly I heard this in. One of the first thing I would say to that is to be makil in taharat mishpacha. To be lenient in the laws of nida is to be machmir in shalom bayit. So that's just one caveat that I love that Nishmat, kind of the rubric that they put it under. The other thing, though, is that Chazal built this system so that there are all of these ways that a woman would not be a nida. A woman is only a nida according to the Torah if it's a full flow, and she feels. And the way that the halacha developed, a woman is going to be a nida even if she sees a drop of blood. And Chazal said that is so extreme, we need to come up with all of these different parameters, these different ways of a woman not being a nida necessarily every single time she sees red, because it's not always going to be a flow. It might just be a stain, a ketem. So it's Chazal built it that way. They built in the loopholes. It's also a halachic model. It's not a scientific model, which is why when you talk about staining and spotting, it's different from when a US might talk about it, because what you might be seeing might halachically still might not be nida. So I guess I'll do an overview after. I guess I'll ask you a little bit about it. What this is a broad question, Ilana, but what is staining or spotting medically?
Right. Yeah. Well, yeah, that is a broad question. So basically, you have to determine what's normal and what's abnormal in order to determine, whether you have to pursue medically. Could there be a problem leading to this experience by the patient of abnormal bleeding? So, for example, what I'm saying is that some people will get their period more frequently than others, and to some people that's normal, and to other people it's not normal. So, for example, classically, a woman should get her period every 28 days. And when I say that, we count from day one to day one to day one to day one. Should be 28 days. So if you get your period, January 1st, and it lasts for 5 days, then your next period would be January 28th, and it would go into like February 4th. So some women will come in and say, I'm getting my period twice a month. Something's wrong with me. That's not really twice a month. That's
their cycle.
Right. It's their cycle. Now, a normal cycle may not be 28 days. Nobody says the cycle has to be exactly 28 days. Some people's cycles may be 24 days, and it's annoying. It's annoying for them, but that's what it is. And even 22 days could be a cycle for some people, and that could be normal for them. So it's important. The most important thing I think for women to do is have an idea of what their periods are. One of the best things about smartphones, there's a lot of good and bad, but the charting that happens with smartphones, like I have tons of teenage patients, and I tell them right away, start charting your periods from a young age. Take personal responsibility and chart them, because you'll see how things change over time. Years ago, women didn't pay as much attention, or mothers would be writing it down on the kitchen calendar. There's still plenty of mothers that write down all their daughters' periods on the kitchen calendar, circling it. But it doesn't teach you personal responsibility. All women should be doing that. Young women, because you could.
Which is actually, I would say, the same. Sorry,
yeah?
the same in the US at neither world of like the more information you have about yourself, and your body best. So the more we can help you with the more information that you have.
Right. So yeah, so some women have shorter cycles, some women have longer cycles, some women get their period every 34 days, and that's normal too. Um, anyway, so that's one issue. And then the other thing is like, you don't know where the blood is coming from. So you really need an evaluation to determine, is this blood from the vagina? Is this blood from the cervix? Is this blood from the uterus? And sometimes women are having blood that is not even from vaginal blood, but it could be urine and they think it's blood. And I've had women who've had
Mm,
rectal bleeding and they think it's vaginal blood.
wow.
So
Right.
yeah, you know, as a gynecology, when you sit down and do an exam, there are three orifices. You have the urethra, the vagina, and the rectum. Some people don't know their anatomy, and they just don't know. So it's important, you know, to
Yeah.
evaluate.
Yeah. So is there I would say would you have a guideline for when women should seek medical attention?
Sure. Well, it depends, of course, on their age. It's not just what they think is abnormal, but age is an important factor. So the truth is, everybody should have a family physician or a gynecologist that they feel comfortable talking to and going to on a regular basis. Because, you know, if they're not sure, they reach out and their doctor can tell them, you know what, I think you need evaluation, you need an exam. So the guideline, you know, I would say if a person in general is reproductive years and is already getting their period regularly, let's say they're 18 and they know they're getting it regularly, and then there's a change. Suddenly their cycle is off, it's different, it lasts longer, it lingers, or it's coming very late. That's when you should seek help when there's a change.
Right. Right. I see we do have a question. Um, this woman has a Mirena IUD for almost 6 months. She was put on Agestin twice for staining issues, which led to a flow both times. I stopped. She managed to get the NIDA off of NIDA, but now, right after mikvah, she is seeing red blood again. It's not a flow yet. It makes me feel guilty. It's a very common feeling. Not counting it as NIDA, if it doesn't meet the requirements of a NIDA stain, can I go on being intimate with my husband with this not technically NIDA stain with red blood or even brown? Is the IUD just not for me if it is causing this? So I definitely think the last question is for you, in terms of whether
Yeah.
IUD is for
So
her.
let me just jump in because I
Want to
think
take
the
that
meat of
first?
this will
Yeah.
be for you. But yeah, so sometimes, I mean, you definitely a lot. I had a girl actually come in today for this to be evaluated because I mean, every day, but the IUD sometimes a side effect of Mirena, Kylena, Liletta, all these things can be irregular bleeding. It should be evaluated if it persists. I would say if you're having abnormal bleeding more than a few weeks, maybe 2, 3 months, it should be evaluated to make sure the IUD is located in the right location, that there's no uterine tenderness, that it's not too low, that it's not too high, and not just a vaginal exam, but I also believe, or speculum exam, but I also believe an ultrasound is really helpful in these circumstances because sometimes the IUD just is not sitting right. So a 3D ultrasound can be helpful. And sometimes I've sometimes removed IUDs and replaced them and had no trouble the next time with them. But again,
Mm,
it's uncomfortable. So
right.
I'm not pushing that. I'm not, but in certain, depending on the patient and the conversation you have with your physician, that's something to consider, even if you're putting in the same IUD again. Sometimes there's an infection in the uterus called an endometritis, which
Mm,
can lead to abnormal bleeding as well. So sometimes I treat people who have persistent bleeding with the Mirena IUD with a course of antibiotics. Um,
wow.
you know, so it's a partner discussion with the patient as to whether or not to try that. And sometimes we use hormones like agestin. The problem with agestin is, you know, it's
Does it have
temporary.
level?
Usually, the bleeding might stop with agestin, or I should say a progesterone. There are different types of progesterones. The bleeding may stop, especially with higher doses. But then when you stop the medication, often you have a bleed. So I don't
Right, 'cause I
know.
was gonna say this woman said she was put on Agestin twice, but then it led to a flow.
Well,
So
I would expect that. I would expect that maybe
mm,
afterwards you'd have a flow, but then but following the flow, hopefully things would be better. We've
oh,
also some women I try birth
interesting.
control pills, regular birth control pills as well. Um, but you also need, like, I have seen women who come in who have abnormal bleeding with the Mirena IUD, and it's really not the IUD. Sometimes it's a cervical erosion. Um, Sometimes it's an endocervical polyp. When you have an IUD, it's pretty common to get polyps in the cervix. Maybe it's the
Mhm.
IUD string that's irritating the cervix, and then you remove the polyp and the problem goes away. So if you haven't had an exam and you're just calling the doctor and they're calling in a Justin, I think you need an exam. And I think an ultrasound would be in order. Those are options. And as I said, possibly antibiotics and possibly just switching out the IUD. It doesn't mean it's not for you. I've seen women with a Mirena IUD who have this problem for a while. And then, you know, if you're doing it for 6 months and you keeps having a problem and you're, you know, and the Yoetzet feels that it's a problem, or your rabbi feels it's a problem, then it's a problem. And then you're going to have to address it and take it out. But why don't you, Ruthie, deal with the fact that it may not be a problem?
Right. So I definitely, again, the idea of someone feeling guilty about it, it's just, if you can try to reframe it as this is what Chazal intended, Chazal created it this way, and that it's a halachic system and not a scientific system in that way. So I have to say, IUD, is it a flow? Is it a stain? Is probably like 70% of questions. I don't know if it's that high, but it's a lot. It's a very, very common question. And it's also, the answer is not a science. But I will try to address this also. And I should also say, if you have a question, always feel free to reach out to a Yoetzet or a rabbi, because they can often ask you very pointed questions about where to get you to understand what's going on. So she did bring up colors. So just to review, with a stain, any red, pink, peach, or black, or peachy pink, red, any of those is something to examine. But as long as the other criteria of staining, then it actually might be fine. Brown is fine. So she said or even brown. Brown would actually be totally fine, and she should definitely feel no qualms about having a brown stain. The biggest thing with IUDs is the volume of how much a woman is bleeding. So there's two approaches halachically to decide whether that is a period or not. The approach from Nishmat is a quantitative approach. If it's more than a certain amount, then it's going to be considered a flow. So a lot of questions that Yoetzot use to determine whether it's a flow or not is, do you need to wear a liner? Or is it not enough bleeding not to even wear any hygiene protection? If you are wearing a liner, which is also fine, is it enough that the liner is getting saturated and you have to switch it out several times during the day? Without a liner, are you really concerned that the staining is going to leak through to clothing? Is the woman feeling gushes of blood and reddish discharge? So those are just some of the questions that Yoetzet might discuss with a woman who calls with this kind of question, because that can really gauge, is she really seeing a flow or is it a stain? That's the quantitative approach from Nishmat. Other poskim, which is not how Nishmat holds, is the qualitative approach, that each woman knows what her period feels like. So if she experiences a mid-cycle bleeding that's lighter than her regular period, then it's just staining. However, on the other side, which is more machmir, if a woman starts using a hormonal birth control and every month she starts having this light staining that is her period, the qualitative approach would say, well, then that's her period and therefore she's a nida. Now, again, Nishmat, to go back, would say it's not her period, it's just a light staining. Even though she gets it every month, even though she gets it at the same time every month, if it's still a light staining, she's not saturating a panty liner, it's just a little bit of staining every month, then it's not a flow, and she can just treat it as staining. The halachic advice is to not have sex for the range of opinions, but 12 to 24 hours to make sure that it doesn't turn into a flow. But that's the Eitzah Tova, the halachic advice, which is why it's really important for everyone to reach out to their halachic authority to discuss how often is this happening, how often does it turn into a flow, because then possibly someone could be intimate with their spouse. If it's something that they know is going to be a stain, they know it's not a flow, they're not really looking, they're not really conscious of if it's red, etc. So, ooh, is my camera still there? Okay.
I do want to mention that, like, if you've had problems with a Mirena IUD, It doesn't, and you can't seem to work it through, and most people do. I mean, I have tons of patients who most of them, like, are able to work it through. The first few
No,
weeks might be tough,
that's
but
very
then it
encouraging.
generally works. But yeah, but it generally works, especially if you can get over this feeling guilty and learning how not to look too much and not to be, um, not to make yourself crazy about it. However, there's also this, I just want everybody to understand that sometimes, like, it may not work for you because it might be slightly off a little bit. It might be that one arm might be embedded in the uterine wall, causing irritation. And sometimes where it doesn't work for you at one point, it really might work for you 2 years later. In other words, if you used it between kid one and kid two, and you're afraid to use it after your second child, and you try using the mini pill, whatever, you don't be afraid to try it again because it really might work for you the second time. I've seen that happen. Don't know why
That's
exactly.
important advice.
Yeah, but like, people also feel the way about the pill. Oh, that pill was terrible for me. But you know what? Years later, it may not be terrible for you. You're different. Your body's different. Um, yeah.
Pills
So
have
just
come a long way as well.
yeah. But our bodies change as we get older. Like we're
Right.
constantly changing. So you just have to be kind of flexible and open minded.
Right. And then I would also say the emotional component of, is this birth control working for you? If it's something that a woman can't really kind of get over that guilt or get over that feeling of having staining every month and not knowing, and that's just making them really anxious, then like maybe it's something, maybe it's worth looking at of a different kind.
Yeah, maybe
Although
they
I
would do
would
better.
definitely try to,
I'm sorry,
yeah,
Bracha. Ruth, I was going to say they might do better. They might take a break for a while and then end up trying the smaller IUD, the Kylena, which has less hormone.
yeah.
That might work better.
In your experience, are the like in terms of staining between different IUDs, Mirena, Kylena, it very much depends on a woman's body.
It does. Yeah, it does. I tend to use Mirena because I see much more. Well, to discuss with the patient, but like in a person who wouldn't mind achieving no period, what we call amenorrhea. Some women absolutely don't want that. But like a significant percentage of women don't get periods at all with the Mirena ID. And if that makes you
Yeah, that's
uncomfortable,
my
the Mirena
experience.
ID isn't the right choice. I mean, some people really like the cadence of, in terms of their intimate life with their husband, getting their period. And I find some women are like, I don't really
Yeah,
like it. I don't want to be on 24/7, you
right.
know?
So I actually spoke to a woman who was on the Mirena, and she would get very light staining every month. And she was very comfortable with treating it as light staining. She made sure to wear dark underwear and to she tried not to look when she went to the bathroom, etc. But she said kind of whenever she would every couple of months, she kind of would like let herself become Nida because she kind of wanted that ebb
Yeah.
and flow.
Yeah.
Um, yeah, so she did that for herself.
The dynamics of the relationship come into play here. I've had patients over the years who it could be a power play in relationships. I've seen, kind of unhealthy relationships where,
mm,
yeah, the husband wants to inspect and see what is it that she's
ooh,
causing the stain or flow. Yeah,
oh boy,
I've seen
oh boy.
that. Yeah.
Ooh.
It's important. I know, keep that in mind with you when you're talking to women. If that comes up, it's worth asking that. Because there's tension in the relationship, you should like explore that a little bit.
Yeah, there's a lot of pastoral aspects to both of our jobs.
Yeah, yeah,
Um, all right, I'm going to
yeah.
we have some questions here. So switching from birth control to perimenopause. I'm 54 years old. I had a normal period a few weeks ago. On the day before I was supposed to go to the mikvah, I started having some light bleeding or discharge. It was not enough to require a tampon, but I did need something to protect my underwear, such as a light pad or panty liner. They seem to be diminishing over a few days, but it keeps coming back, and I have not had anywhere near a clean day since this began 12 days ago. The discharge is now lighter and purely brown. My question is this: does this now count as bleeding? What happens to a couple's sex life during the onset of menopause? So I'm gonna ask you to talk about perimenopause first. That's like what is going on,
Okay.
I guess, with the woman's body and
Yeah. Perimenopause is a tough time. For some women, it's not it's fine, but other women have a really tough time. So what happens is
Yeah.
as the ovaries age and as our bodies age, the cycle changes. And if you were a person who used to get your period every 28 days, you'll notice some subtle changes. Very often, the periods start to get closer together, actually. Like instead of every 28 days, it might be every
It's really
24
hard.
days, 23 days. So, like in the
It's
mid,
exhausting.
perimenopause can start in the early 40s and mid 40s for some women. So you notice the cycles getting closer together, and it's tiring because as you can imagine, the window to be together is shorter. And that's why a lot of women end up going on birth control pills at that time if they're candidates for birth control pills, just to be able to extend that time when they cannot be in NIDA actually. And that's fine. But there are risk factors associated with birth control pills. So every person has to discuss those risk factors with their physician to determine if that's appropriate use of medication. But abnormal bleeding we always have to differentiate pathologic causes from abnormal bleeding from non-pathologic causes. So perimenopausal bleeding, abnormal bleeding, is almost a diagnosis of exclusion. If a woman comes to me and tells me I'm bleeding for 3 weeks, and I'm 47 years old, I'm not going to assume it's perimenopause. It very well might be, but I'm going to have to do the workup to see, is it perimenopause? I don't want to, God forbid, miss something. So very often we have to do like looking. Obviously, I'm not going to give them agestin and tell them to call it a day. It's going to come in, do a cervical exam. When was the last Pap smear? Is there cervicitis? Is there a cervical polyp? Is there a submucous fibroid? Fibroids are benign growths that can be located in various locations on the uterus. They're generally benign, but they have to be evaluated. And sometimes they're very annoying and they could be the source of pain, of bleeding. And so sometimes they need to be addressed medically or surgically. And there are medications to treat fibroids medically or surgically. So in order to call it just perimenopausal bleeding, I would want to know that there's no polyp, there's no fibroid, there's no hyperplasia or precancerous lesion, and there's no cervical cancer, and do the workup. So that's why it's important to call your doctor, when you're having bleeding, to sort of do that workup. Once you do that workup, if you deem that there's no organic pathology, then you could say, okay, this is probably perimenopausal bleeding. What can we do about
it? Wow. And so at what point in my perimenopause would you tell a woman this is normal? This is a normal occurrence of perimenopause versus this is something that we're more concerned about?
I honestly, I will do the workup pretty much frequently. In other words, I'm going to tell them. Depends on the patient. Like if someone has risk factors for endometrial cancer, I'll be more aggressive than someone who doesn't have risk factors. But I tend to say, you know what, let's get an ultrasound. Let me do the pelvic exam. Let me do an endometrial biopsy. Let me do a hysteroscopy. Depending on the situation. But because once I do that, I'm like, okay, everything's fine. Okay, this is perimenopause. We don't have to worry. There's no cancer. There's no problem here. This is just your hormones are acting up and you're just going through the normal transition. I mean, when we go through puberty, we go through a transition, and thankfully we don't remember things too much because that's a pretty tough time physically and emotionally. So it's almost like backwards puberty, it's brain changes and hormonal, and also usually at that time in one's life, it's a tough time. If you're dealing with work and kids and your parents are getting older and your kids are getting older and like you have so many stresses up the wazoo and you're the last person on the list, unfortunately, but you have to get to the doctor and figure it out, because once you come to the conclusion, if it's perimenopause and you've ruled out all the other things, then we'll use medications or treatments to figure it out, to treat you, to make life a little bit easier. You also have to, of course, worry about contraception. So sometimes it's the contraceptive issue, like the Mirena, that's causing the abnormal bleeding, and then you stop that contraception, switch to a different contraception, and the problem goes away. And sometimes you need surgery to fix the problem.
Gotcha.
I mean, I think one of the things we do most often is dealing with abnormal uterine bleeding. It's like one of the most common diagnostic codes I use.
Sure.
All of us, yeah.
I am getting a note. If anyone is interested in hearing more about perimenopause, there is a Ask Me Anything on perimenopause tomorrow in the conference. I was told to plug that. So halachically, perimenopause is It's I don't know if I would say complicated, but just tiring. Like it just you feel your heart goes out to just women who are. It's just so unpredictable often, and it's frustrating. Um, so this specific question was, she said perfectly, it was not enough to require a tampon. I did need something to protect my underwear, such as a light pad or panty liner. So she already knew enough for that level of, it wasn't that much, but it was something was there. But she said it diminished over a couple of days and it kept coming back, which is so frustrating and exhausting. But she said, so she couldn't get a clean day, but she said the discharge is now lighter and purely brown. So it's also, how do you define what a clean day is? In this is the type of scenario where she can certainly do a Bidika, and the Bidika, because I think she said she became Nida again during those 7 clean days, her Shiva Nekiyim. So she has to do her Shiva Nekiyim again, but it was brown, and brown is totally fine. So even though this woman, she wasn't getting purely white Bidiko to purely clean, I would say clean Bidiko. Halachically, they're clean. It's brown, and she should definitely keep going. So in general, though, those types of questions there's never a stupid question. I have never gotten a question that I felt was stupid or silly, or why doesn't this woman know? I've never felt that way, because it's just so, I'm just happy when people reach out and ask. So if a woman ever does have a question about staining or about a Bidika, just reach out to someone, because a Yoetzet or a Rav would be happy to help. And I think more often than not, people are surprised by Kula than Chumrah. So it's always good to reach out.
There are a lot of women who end up going on birth control pills in their late 40s because of these annoyances.
And it helps.
Yeah, absolutely. Regulate cycles. As long as the person's a good candidate and they're not, there's no medical contraindications.
Mm-hmm. Interesting. Moving from perimenopause to menopause. This woman said, I'm 52 years old. I haven't had a menstrual cycle for 2 years. And after the last gynecologist check, I'm definitely in menopause. And after being intimate this time, I noticed a very pale pink color when I wiped myself. It wasn't red like blood. I did check with a Bidika cloth and there was nothing on it. Would I be a Nida? What should I do? Do you want to address bleeding once a woman is in menopause? And this is also this is a much more complicated question, because not complicated. This is more layers, because she also had postcoital bleeding, blood after sex.
Right. So postcoital bleeding usually needs to be evaluated medically, and postmenopausal bleeding needs to be evaluated. In other words, an exam should be done just to make sure that we have to look at the vulva, which is the external genitals, and the vagina and the cervix. There's a strong likelihood that the bleeding was from the trauma of intercourse, because of postmenopausally, the vagina becomes less pliant. It loses elasticity, and it's more prone to tiny little lacerations. And so it's very common to have sometimes trauma with some staining after intercourse.
And vaginal dryness as well.
Yeah. So because there's less, the vagina secretes less fluids during relations. And so, so in other words, that could just be from the trauma of sex, but that's kind of thing, though, that should be ascertained on an exam by a gynecologist. I wouldn't assume that, because you really should go in and have a good exam. And if that's deemed, if that's the reason, then it's nothing to worry about. And then we could actually treat it with various medications, lubricants, vaginal moisturizers is one category, lubricants is another category, and various treatments in the vagina, estrogen and other medications that can help relieve if the problem is vaginal dryness. Sometimes it's not. Sometimes it's other skin conditions that affect the external surface of the vagina. People think they have a yeast infection or something, but no, they have a skin condition called lichen sclerosis or lichen chronicans. These are skin conditions. That's why it's important to get vaginal exams, because nobody's looking down there. It won't be diagnosed unless somebody is actually looking to diagnose it. That happens quite a bit, that we have to do a biopsy. We come up with a different problem for the bleeding, and then we could treat it, and the bleeding will go away. So
wow,
that's the GYN aspect.
Wow. So So she did say it was pale pink, which might be a problem. We have a question with postcoital bleeding also, but in general, a couple is supposed to wait until they wipe themselves after sex so that it's not linked to sex and possibly masked hargasha that they possible nita d'oraita. But my the red flag in this question for me as the website was she said I did check with a Badika cloth and there was nothing on it. If a woman is not doing her Shiva Nikiyam, there is no reason that she should be using a Badika cloth or checking internally with a tampon or anything else that would have made her a nida. And it might have been just a stain had she not. Meaning she happened, thank God, this woman had a Badika cloth and there was nothing on it. This a little bit goes back to the guilt question of, oh, let me just check. And that's not what the halacha says. The halacha doesn't say you have to check if you're bleeding. The halacha says, is it a flow or not? Had this woman's Badika come out pink or red, it would have been an issue. So definitely never ever, and I have this when I teach kalas on like every unit, I have in bold capital letters, never do a Badika just to check. Or I would say unnecessarily so. I talked to a woman, it was like soon after she had gotten married, and she got married around the Rosh Hashanah and Yom Kippur, and she thought she was staining, and she checked. She said, what did she tell me? She called me and said, I think I thought I was staining. So it was Yom Kippur and I felt bad. So I just did a Badika just to make sure. And then she ended up becoming a nida, and they actually brought it to their rabbi, and the rabbi sat them down and as a couple and said, like, let's walk through everything you did wrong. Just because he's like, I want to educate you. I want to empower you. So she was telling me the story much later on. And I also was wondering, how her college classes went, that she didn't remember that stuff. But so that's just one thing I wanted to add there. So if the woman had waited a couple of seconds after sex when she had wiped herself and she had not done a Badika cloth, and it was a small amount of pink color, she might be fine. I guess more details would have to be figured out in that scenario. And also, where did she see this wipe? Toilet paper is not, Nishmat does not hold toilet paper as makabel tuma, or seeing it in the toilet bowl or on the toilet seat. So she really could be fine in this scenario. So we mentioned this also, postcoital bleeding. I've noticed lately that after intercourse, I have discharge the next day that is reddish. Can you explain to me more about what could be causing my spotting and whether it is possible that it makes me nida? So the first question is actually right at you. What is happening here?
Right. So postcoital bleeding, sometimes the cervix, like during sex, obviously the trauma of the penis and the vagina can cause bleeding, but also the penis can hit the cervix, and you can have cervical inflammation that can cause bleeding, cervicitis. I've seen like patients have like erosions, lesions, herpetic lesions can cause bleeding. Sometimes on birth control pills, the cervix, there are changes on the cervix such that certain cells are more exposed to the outside than in the inside, and they're more likely to bleed when touched. So there are a lot of things that can lead to bleeding after sex, and that needs to be looked at. We can cauterize in the office if we see something clearly and the pap smear normal. Then a lot of times I'll cauterize a little bit in the office, and it stops the problem. Sometimes people are using diaphragms. I don't have too many people using diaphragms anymore, but I've seen erosions from people leaving diaphragms in. Pessaries, which are other devices that are left in. That's in older women. They get erosions from that. So yeah, I mean, it's just, an exam needs to be done to determine where this blood is coming from. Thank God it's very easy now. We do hysteroscopies in the office, which means I have a little camera that looks in the vagina, looks at the cervix, looks up at the cervical canal, and looks up in the uterus. And I could see, is there a polyp there? Is there something that could be causing the bleeding? And because then that's 1, 2, 3, we remove that and the problem goes away. So it's important to get to the source of it so we could treat it.
Halachically, so we just want to make sure that this woman, that there is, as we said, time between when she notices bleeding and when she, between having intercourse and when she notices the bleeding. So as long as she's not in that time, time frame, then it's just a question of whether the staining is needed or not. What is it? Is the color, the color is it the source? Is it uterine, or is it something like she went to the doctor, got it checked out, and she saw that it was in the vaginal canal. It was not uterine bleeding. Was it the location, the volume? We would just go through all of the regular staining questions at that point once there's enough time between the sex and seeing the blood. I'm just noticing a question that came in.
I just want to mention that's really important postmenopausally, if there's any staining after sex, not to assume it's just vaginal dryness and to get it evaluated. Postmenopausal staining always has to be evaluated for cancer. If a person were to have a cancer of the uterus or the cervix, that's something that we need to know and treat, and then people could be fine afterwards. So that's just always important. That's why I always think of the medical possibilities.
Well, I feel like it's the same thing with Yotzot when we're like, just ask the question. With doctors also, it's like, it's just call your doctor, get it checked out.
Yeah, be seen.
It could be nothing, but it's a good thing to have that information.
Right. If you feel your doctor is blowing you off all the time, then please go for a second opinion, because you want to be seen. Tell you, medicine is so difficult these days, and it's so hard to squeeze people in, and every doctor is squeezed beyond belief and backlogged, and nobody can get in, and because of electronic
weighed
medical
down
records
with paperwork.
Now, so much paperwork. We call it paperwork, but it's computer work. But patients are booked at slots, and you can't just add people in like you used to, and there's a lot of pressures. It's really crazy. Medicine has changed a lot, and so sometimes it takes a while to be seen. And that's so if you feel like you're not being heard by your doctor, call again. And say, if you can't see your doctor in the practice, then go see somebody else in the practice. Go ask to see a partner, ask to see the nurse practitioner, but get the exam. Advocate for yourself. If they're constantly taking care of everything by phone. Oh, it's a yeast infection. Oh, it's a UTI. Oh, this, that, the other. No. At some point, you need an exam.
Right. I was speaking to a young woman who was getting married who she was talking to me about having negative side effects to birth control, not even halakha questions. She was just kind of venting to me about it. So I said, you should really call your doctor, really talk about what you're experiencing and if this is the right birth control for you. And she said she just couldn't get through to her doctor. And they're not getting back to her. She just couldn't get through. And I said, that's a problem. I'm sure they're busy, but you have to be able to get through to your doctor.
It's a problem. I could tell you, being a doctor working, it's a problem. Yeah. After seeing patients all day, I have a list of 20 people to call. Really, messages, phone calls, and there's no time in the day left for that. So it's not, it's a lot. It's hard. It's very hard, and I have to, prioritize and make sure to get to. So, my husband is over there making faces because he's a doctor too, and he's like, oh, he just walked in the door now. Because he's probably spent an hour doing telehealth, COVID questions, whatever. But
anyone who's watching later, it's almost 10 o'clock and he just walked in.
Right. But the point is, some of the EMRs now have chatting, which sometimes is easier. But don't be one piece of advice I can give is, if you can't speak to your doctor, speak to the nurses, because usually the doctors work with nurses who they train and know what they're thinking, and the nurses may be able to take care of the first line of questions, and then if they're having a problem, then bump it to the doctor. So that's it.
Or PA, yes, absolutely. As long as you can get through to the office, absolutely.
Oh, you have to be able to get through the office. You have to be able to talk to somebody, and
I should clarify, the woman couldn't get through the office, but
oh yeah, then that's a problem.
Yeah. We have a question in the chat. Are the halachot of staining different during the 7 clean days? If I only do the minimum badikot and don't check in between and don't wear white, are the laws of what makes you the nida the same? Interesting. So I guess I'll answer the second part first. So this woman is saying that the doing the check the 7 clean days. So the halacha doesn't change. The halacha doesn't change depending on how much a person is keeping and what stringency a person is keeping. Some people do 1 check a day. Some people do 2 checks a day. So the halacha does not change. The question about our halachot of staining different during the Shiva Nikiyim. So that is, I would say, it's very important to ask one's personal. I grew up with the saying, you're a local Orthodox rabbi, you're LOR, but your halachic authority, whether it's a Yoetzet or a Rav, because there are different opinions about this. Technically, staining, and there's also different opinions about where in the Shiva Nikiyim, where in the 7 days. Some people might be a little bit more strict in the beginning because you're still finishing your period as opposed to later on. The bedikot always have to be quote unquote clean. They always have to be acceptable colors or clear. But staining, yes, staining, the same rules with staining. So, I mean, that would be why some women, if they do wear white underwear, they would bring the white underwear to a Yoetzet or a rabbi to look at it and say, is this something that would, is it red? What size is it? But it's really a much more personalized question, and also depending on sometimes the scenario. So staining rules do apply. How much? We've got 20 minutes left. Okay, we could do a couple more life scenarios. And if anyone, please feel free to send in more questions. Pregnancy. So if a woman, it's actually halachically, if the halachot are the same in terms of staining or flow, I think it's more medically. If a woman sees bleeding in her first trimester, I'm going to start that question first. What's going on medically? When should she seek help? In the first trimester.
Right. So first trimester, of course, there could be implantation bleeding. In other words, you're expecting your period and you have a little staining, and really it's just the implantation.
Oh, hello. Am I frozen or?
Staining in pregnancy, bleeding in pregnancy, we always have to make sure that it's a normal pregnancy. I like to see that it's a uterine pregnancy and not an ectopic pregnancy. That's, of course, number one, because that's something that's very dangerous. An ectopic pregnancy is a pregnancy outside of the uterus. So whenever a woman has bleeding, the number one thing is we say, right away, can I ask her to make sure this is uterine and not an ectopic? Once we know it's a uterine pregnancy, then it's less worrisome. Still needs to be evaluated because any pregnancy shouldn't have vaginal bleeding. It's common, and very often it happens at the beginning, but we need a diagnosis as to figure out why there's bleeding.
And then second and third trimester, are those different? Would that be different if a woman was staining or bleeding during that time?
Yeah, there are a lot of things that can cause bleeding in pregnancy, and each one has to be figured out what the cause is. Is it from the uterus? Is it a placenta problem? Is the placenta implanted in a funny location? Is the umbilical cord in a funny location? Is there an abrupt, it needs to be worked up. So for the 9 months of pregnancy, ideally, we don't want to see any bleeding.
Right. So I should also mention, it's possible a woman can become nida during pregnancy, which I think most women do not anticipate because your period stops and therefore you should never be a nida. It is actually possible, unfortunately, for a woman to become nida during pregnancy. So the same rules of staining would apply of, trying not to look. And I should also mention with that, that piece of advice, meaning not a couple of years ago, the advice has always been, don't look when you go to the bathroom, like try to wipe and then don't look. And I feel like there's been a resurgence in the last couple of years of women saying, like, I want to look. I want to know what's going on in my body. And therefore, Yoetzot have responded and said, if you need to look and that makes you feel better, look, that's fine. Just let's go over all of the staining rules and limitations and parameters so that you, as empowered and educated, can feel you know what to do if you do see something, because you do want to look. So I should mention that as well.
Lucy, I want to mention one thing I find interesting with my patients. A lot of people, when you get married, you learn all the halacha, you meet with your kala teacher, and of course, right after you get married, then you're putting into practice what you theoretically learned. And so even though you learned things, you forget things. But then you forget everything once you're married. And then you're breastfeeding and you forget. And, it's important to have for women to be able to feel comfortable that they can have a retraining session to remember those things.
Absolutely. Absolutely.
Yeah, without feeling bad about it. And then it's not just pregnancy postpartum, because so many women use contraception that pushes off their periods, and have limited
Yes.
number of periods per year. They forget too. So a lot of times women are asking me to remind them, and I absolutely refuse because I forget myself. But I find that, like, whatever, it's a problem. I feel like, it used to be you'd get your period every month, so you'd remember everything because it was
Right.
fresh, but no longer. Now
Yeah, from
more and more and
practice.
more women are pushing off their periods.
Right. Which definitely goes back to like, there's no dumb questions. Always feel free to reach out to someone. But I would also say it's something that I learned to also impress upon women of like, continued education. I mean, we all should always be learning more, in whatever area it might be. It's always good to read more. It's always good to learn more. Same thing with whether it's NIDA or sex or gynecological health. Like, it's just always good to continue to have those conversations and to questions and information. I feel I'm sometimes very aware, hypersensitive to the fact that whatever I might be teaching a kala, I'm like, I have no idea what's going to go in one ear and out the other, because it is, if they're not practicing at that point, that is totally theoretical until they do. And it's a very busy time because they're getting married and their life is about to change and they might be moving and doing a million things. So for sure. And a lot of a lot of college teachers give refresher courses for that reason, and it's definitely important to
Yeah.
um,
I have
have those
tons of
reminders.
patients for kalas, and it's very interesting to visit, talking to them before the wedding versus, when I see them a few weeks or months later. It's a different person I'm talking to.
Wow.
Yeah.
It's an amazing resource to have you as a doctor. Just have a from doctor.
It's a big, it's a life-changing thing.
Yeah. Postpartum question. I'm nursing a 3-month-old and have not had a period yet, but lately I'm staining a lot. I am not using hormonal birth control. 2 weeks ago, I had a bout of staining for a few days, and now again, it's 1 to 2 stains a day. And by now, it seems very unlikely that an actual period is coming. Should we still refrain from intercourse? I understand that stains on the husband's body are complex, but what if we specifically avoid looking and just shower right afterward? So I guess I would ask you, just first of all, postpartum, was typical in terms of when a woman gets her period and what she can expect, and is this kind of staining on and off?
So nursing is tough because nursing, first of all, the vagina is dry during nursing, and so a lot of women have a little bit of pain during intercourse, and a lot of women stain from that. So that's an issue. Number two, some people are pregnant and they don't realize they're pregnant again. I've seen that more than once. So it's important, like, if you have abnormal bleeding, if you've been sexually active, that you do a pregnancy test. Anytime there's abnormal bleeding, always do a pregnancy test, because if you're having sex, then there's always a chance you could potentially be pregnant, and it could be an abnormal pregnancy.
Even if you're nursing all the time.
Yeah. Yeah.
Not a reliable.
No, it's not a reliable. I mean, it's a good form of contraception for the first 12 weeks. If you haven't introduced any bottles and the baby is only on breast milk, it's a relatively good form of contraception, but it's not quite, it's not perfect. So that's an issue. Yeah. But abnormal. So occasionally there are problems with a remnant of a placenta left inside, or a remnant of membrane that's left inside. Sometimes it's very rarely, but it's a non-healing area up in the vagina. That's rare. Yeah. Sometimes it's an infection. These are not common issues.
Yeah.
I don't see it too often. I do see that women, like, the more children, this becomes more of a problem with your third and fourth kid. I feel like the abnormal bleeding, at least from what I've seen, tends to last a little bit longer. And I haven't read that medically anywhere, but just what I've seen.
This is what you've seen, anecdotally.
Yeah, anecdotally,
Sure.
that's what I've seen. I don't know if there's any reason or merit to it, but I just noticed that in my own practice. And that's a problem. So yeah, whatever. I try to right away take care of that, in terms of, because the last thing you need is to not be intimate with your husband when you're exhausted and you're taking care of 2 kids, and the fact that you can't touch, whatever. So we try to fix that right away and try to pick the appropriate birth control methods.
right away to solve those problems.
I have a side question though. I'm thinking of you as a doctor, knowing the halachot, and not just knowing the halachot, because Nishmat actually has a website for women. If they go to doctors who are not knowledgeable of NIDA, they have a website that explains to medical professionals what NIDA is. But you also understand the emotional aspect from this of a woman has become NIDA. Now she can't touch her husband, or they can't be intimate, whatever it is that might be really emotionally difficult. Do you have not religious or not Jewish coworkers that you've explained this to from patients before?
Yeah, of course, with cultural sensitivity, of course. Muslim patients also go through periods where they're not touching. It's not just in our culture. And it's,
Right.
we try to teach about, diversity and sensitivity. It's hard. It's hard. Not just teaching, but the actual dealing with that, the not touching after having a baby or after having a miscarriage.
No, of course.
Yeah, these are hard things. They're challenging. And that's why if you don't have an Orthodox doctor who understands that, you have to make it clear to them, because it wouldn't dawn on them that you can't hug your husband, you can't touch your husband.
Right.
Like, who thinks of that? Like, okay, not having is one thing, but yeah.
Right. But then I was thinking, like, even once they might become informed about it, they might not understand what that means, or just realize how difficult it might be for a woman or a couple.
Yeah.
Because they get it intellectually, but then there's that other level.
Yeah,
Wow.
absolutely. It's tough. Yeah. So my office pretty much knows those things.
So I didn't answer this question. So she's nursing the 3-month-old. She's not using hormonal birth control, and she keeps having staining every couple of days. So it seems like it's just staining, and so it's not making her NIDA. She can treat it staining as such. It seems so. This is again not refraining from sex because of staining is the kind of the go-to halachic advice. I wouldn't say it's a strict halacha law, but it's a halachic advice. And that's a question that someone would have to talk about with their personal posek or halachic authority, their local yoetzet. And it's certainly, I can tell you the different calculations women will talk about are how much is this affecting their marriage and affecting their relationship, affecting their each person emotionally, how long are they staining for, if it's 1 to 2 days a week, is it something easy to refrain for 12 hours? So it's something people might have to personally just kind of look at, but it's definitely something worth reaching out. 1 second, there are some questions here. Where do I find the articles that explain NIDA to the non-from physicians? Okay, I will tell you. I had it open because I was like, ooh, this is a great thing to point out, and I don't see it here. We're going to try to send that to the chat soon. It is a great website to send. I saw another question here. How long is too long post-baby or stillbirth to continuously bleed or stain? When is it a problem medically, and when is it actually no longer a problem halachically?
In terms of medical, I really, if it's continuing beyond 12 weeks, I think that definitely needs an evaluation. I mean, of course, it depends also on the amount of staining, like if it's like a little bit or a lot, but I don't know why that would be the case. I don't think that's a common situation. Honestly, things are usually done by 8 weeks at the maximum. So if they're still bleeding after that, it needs an evaluation.
Mm-hmm. The question of when is it actually no longer a problem halachically? I think the question is saying, so post-baby, whenever the woman is done bleeding, she counts Shiva Nakim and goes to the mikvah. But we say a minimum, right? We would say a minimum of 14 days. But usually women bleed longer than that. So this is really more of a medical question, that if it's a really long time, we should talk to a doctor. Again, if it is staining and it's browns or it's not that much, then definitely reach out because maybe it's just staining and she can really start counting her Shiva Nekiyim, because maybe it's just residual blood. Oh wait, let me just go back. In general, do we know any other websites on intimacy halacha other than Nishmat? There's fantastic. There are like fantastic. I wish I had time to like put information into the chat. Hopefully, I can do that.
There's Ruthie. Do you want to comment on the podcasts that people could listen to that might have? They can learn.
Yeah, so there is a podcast called Intimate Judaism by a sex therapist, Tali Rosenbaum, and who is it Rabbi Scott Kahn?
Yes, I think it's Scott Kahn.
All right, I'm gonna put that podcast there. I'll put that in the chat. And they are, so I also highly recommend Tali Rosenbaum. I mean, first of all, she's on Instagram. You can find her on Instagram, but also she wrote a book. I usually like sit next to my stack of books so I could show everyone. She wrote a book on intimacy from a Jewish perspective, but it's a fabulous book because it's really it's detailed, it's clear. They even have a paragraph on sex toys. They have a chapter on not a paragraph, a chapter. I'm sorry. They have pictures with anatomy. It's just very clear. Really goes through a lot. 1 second. Okay, Jade, I will take your email down. If anyone else also wants to send their email, I'm gonna put my personal email here. Feel free to email me. Feel free to email me questions for recommendations, or for I will find the Medical US chat. Website that has like what to send to your doctor, which is very helpful. There are so many books. Oh gosh, there's tons of great books and resources out there. Please feel free to email me. I'll send you stuff. We only have 3 minutes left. I'm looking to see. I don't know if that's worth it. I've seen when should someone look for endometriosis or other medical concerns. I have heard women use alfalfa, vitamin C, and bifovflavonoids to help reduce staining. Is this medically accurate?
I've never heard about anything like that.
Okay. Is there anything that women can do to reduce staining?
I'm a fan of acupuncture. I feel acupuncture.
Oh wow!
For really, for some things, for severe, it's been shown to be helpful for infertility, helping women who be more ovulatory, and it's possible.
Wow, that's very cool.
Yeah, but these things are expensive. They're not covered by insurance, and they don't help a lot of people. It's probably a very small subset, so it's not the kind of thing I would recommend on a routine basis.
Right. Sure.
But the truth, medically, we have so many different treatments to figure out what the cause of staining is and things to help staining go away. It's not something women should suffer from. It's something women should just go to the doctor and be persistent and get seen, and get it taken care of, because a lot of things we can do. Thank God.
So I feel the same way as a US set of like, this is not someone should suffer for.
Yeah.
Someone asked me, I was interviewed for an article, and the journalist who was not Orthodox but was fascinated by the concept of US set, he said like, wow, so you must be like really passionate about this area of Jewish law. And I'm like, to be honest, like, no, like, I'm not like, whoa, periods, or like, I'm not even someone who's going to be rah-rah mikvah. I'm passionate about empowering women and educating women and making this less painful and more accessible. So I feel like just what you said in terms of the medical field, it's the same halachically of like, this is what I want people to feel like they can have answers, like there's something that we can address. Yeah, for sure.
And so many women just don't take time to take care of themselves and go to the doctor for regular checkups. They don't nurture that relationship with their primary care
Yeah.
gynecologist. They think of the OBGYN as someone to go to when they're pregnant, but no, you should have a relationship that you can call someone who knows you, that can help you through the all these things, because there's no
That's really
reason.
important to hear.
Yeah, there's no reason.
Wow. I wish we lived in the same city.
Yeah,
I
that'd be
would
nice.
want to go to you.
That'd be nice.
All right. I
Oh.
think it is 10 o'clock, so it is time to finish up. If you've heard nothing, just basically reach out to your doctors and reach out to your yoa. So
Right,
it's always good to ask.
right,
That's the answer
right.
here.
All right. Thank you, Ruthie.
All
Thank you
right.
for your
Thank
expertise.
you.
And thank you for being a yoa.
Thank you. Thank you for being an awesome doctor. Oh my goodness. Good night, everyone.